Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine here, and if I'm moving out of the frame, you'll just let me know. Welcome back to our educational series for parents. Today we're going to talk about bedwetting. Please remember that these video blogs don't replace consultations with your physician. If you have concerns, make an appointment with your doctor to be seen. We'll be happy to see you here. Area code 775-359-7111. We're experimenting with a new tripod here at the request of several of our regular viewers, so if we're having some difficulty, bear with us. This is a learning experience for all of us. So bedwetting. Bedwetting up until realistically the age of 6 is not even an issue. The average age of toilet training success for girls is about 3 years of age and about 3.5 for boys. So prior to 3.5 years of age, it's not considered abnormal to not be toilet trained at all. And after 3.5 to 4 years of age, about 1 out of 10 boys and about 1 out of 10 girls is not yet toilet trained, especially at night. So to have episodes of bedwetting that lasts 6-7 years of age is hardly unusual if it's happening to 10% of the patient population. About 10% of the patients who experience bedwetting after age 6 get better each year. The majority of these cases are what we refer to as idiopathic enuresis. There's no known cause. However, if your child after age 6 is having bedwetting, it is important to be evaluated by a physician. We want to, among other things, sorry about that. So we want to make sure, among other things, that there's no evidence of sacrococcygeal tumors, dysfunction of the genitalia, abnormal genitalia, missing parts, extra parts, parts not in the right place, stuff such as that. That's pretty easily ruled out with an appropriate physical exam. That then leaves us with regular bedwetting. And of course, when we're talking about regular bedwetting, we're talking about bedwetting that's persisted for a long time. New onset bedwetting is a completely different disease and completely different list of things to worry about. So if your child has been dry at night and is starting to wet the bed all of a sudden, we want to see that child quickly. And there's a lot of things that can do this, including diabetes, and it's very dangerous. So if your child is a new onset bedwetter, we want to see you right away. Don't waste time, please come in and see us. But for the chronic bedwetter who really has never been dry for any length of time, what is the most common cause? Well, the most common cause, realistically, is altered sleep. Most of these children are sleeping so deeply they don't recognize the signals from their bladder to get up and use the bathroom. And so they sleep right through it. Many of these kids don't even realize they've wet the bed until morning. If you use bedwetting alarms for these children, the alarms go off, they'll wake up the entire house, but not the child who's wet the bed because he's so sound asleep. So the real treatment is to reprogram the sleep phase for the child, and we do that by waking them up in the middle of the night. So they go to bed at their usual time, and mom or dad needs to wake the child up when they go to bed. And the goal is to alter the sleep to prevent that ultra deep sleep that's not really a normal sleep phase. And in so doing, we can avoid the sleeping right through the signal, and eventually the children will learn to recognize the signals from their bladder to get up. Once they are able to be easy to arouse and wake up, then we can start using bedwetting alarms to further train them and finish the training of the process and ending the problem. We do want to make sure that the child doesn't have obstructive sleep apnea. That's another cause that can cause chronic bedwetting, and that's something that needs to be treated usually through a pulmonary sleep center. A little more difficult to take care of. Fortunately, that one's not quite as common as the altered sleep sensations. People ask me regularly, what about medicines for my child? The reality is there is no medicine to cure idiopathic enuresis of childhood. It takes time. There are some medicines that will help with the problem, including a nose spray called DDAVP and an antidepressant called imipramine. However, remember, if we put your child on these medicines, they stop the brain's ability to learn how to deal with the sensation of a full bladder. Consequently, they're a temporary band-aid. When we take the child off the medicine, they regress back to where they were when we started the medicine. So all it does is delay the time necessary to achieve dry nights. So what is the role of medicine? Well, the role of medicine is for summer camp, for sleepovers, to be able to allow your child to do normal childhood things, but on a day-to-day basis, they are a band-aid and they do not solve the problem. The child must have his or her sleep retrained. And we do that by waking them up in the middle of the night. Remember, again, we're talking about long-standing, never-been-dry children. Children who've had dry nights for months to years, who suddenly start wetting the bed. We want to see them right away. That's something very dangerous, and or potentially very dangerous and needs to be evaluated quickly. I hope this has helped to shed some light on a very common, very complicated situation. Remember that, again, 1 out of 10 children have this problem after age 6, and about 80% are dry by 9 years of age. But that means of those children who have bedwetting, 20% are having problems after 9 years of, or 10 years of age. So if your child is one of those children, although it's a very frustrating situation, the good news is you're in very good company. It's not the end of the world, and most of these children, almost all of these children, go on to achieve dryness at night. We just need to be patient, make sure there's no long-term emotional scars when we're done. This is Dr. Windisch. If we can be of assistance, please give us a call at our office, area code 775-359-7111. We'll see you next time.